Hello, you're listening to the Drawing the Ideal Self podcast for May 2021. Today's podcast is an interview with Adele. Adele is a speech and language therapist and is also qualified as a PCP psychotherapist. And she'll talk about her work with people who have communication difficulties, people who stammer, and also in her work as a supervisor or working with the organisations that she's worked with in her role as a manager. Unfortunately, I still seem to be a bit shouty at the beginning. I think that's to do with the way I do the editing. So I've got to get better at that. I apologise. I'm not sure what I can do at the minute. So Adele, could you tell us a bit about your own professional background and, your career, what you've been up to?
Well, it's a long one. Qualified as a speech and language therapist in 1976. Worked for a short time, then I took 8 years off and had my family, and then went back to work very part-time. So this was all through the NHS, and there was possibilities at that time of going back for a few hours a week. You do a couple of mornings, and then you could fit it to schools, and then you could do term time work only. So I think there's always been an understanding that if you have this female workforce, you have to have flexible hours if you're going to service at all. So I was very lucky in that over the years I just gradually built it up to full-time working, and was able to develop a bit and take on more responsibilities.
Yeah, okay. So, and whereabouts in the country were you working?
I've always worked in Kent, always worked for in the same area, but of course with all the reorganisations that you've always had in the health service, I think there's probably about 6 different organisations by name because of the mergers. But I've always been in the sort of community setting. So I was in children's services for most of my working life, working in special schools, working in community centres and clinics, and working in mainstream schools. And I gradually sort of took on more responsibilities, probably not because I was looking for them, but people have a tendency to ask you to do things, and then if you don't say no, you find you're So I gradually worked up into managing a speech and language therapy team in paediatrics, and then I took on there was another reorganisation, and I took on managing physiotherapists and occupational therapists and dietitians as well. So that was quite a large team for about 5 or 6 years.
Yeah, okay. And then you do some private work or not?
Not really. There was never a dabbled now and then, but it was never really the time.
Yeah.
Working full time and long hours as most of
people
do in health service.
Yeah.
But it was nice. I did enjoy managing and working with other therapists because you learn an awful lot. I always like the opportunity, because if you're a different profession, you can ask a very simple, naive question.
Yeah.
And they're happy to respond and explain things to you. Whereas if you're in the same profession, people sometimes expect you to know.
Yes.
There's always that wonderful idea that you ask a question and then you find something out that you didn't expect.
Yeah. I always think it's a much richer discussion about things as well, with all those different perspectives.
That's right. And of course there was always pressures, because there was always pressures from children and for children and from families, because there was always limited resources, and you had to provide the best you could for even children with quite complex needs. You had to always balance and do what you could, but always knowing that you really didn't have quite enough resources that satisfy that needs. And that's probably what influenced the introduction of more private therapists over time, and quite a number of the younger people that were in my team have now moved into independent work.
Yeah,
we picked up a lot of work in schools, because there's always a lot of negotiations with the education authority about who paid for what and how much money they gave speech and language therapy services, and a lot of parents, particularly in this part of the country where we're fairly well off, families are fairly well off, there was often cases where the parents would decide to spend a bit more money on private lending help, or the schools would decide to employ their own, and they would then cover all of the children's needs in that school.
Yeah.
That was very much happening now. That's moved into that.
Yes. It's very different, I think,
It
now.
is.
Yeah, it's the same in psychology. You know, more people are working independently, and lots of people are working both independent and the NHS. So they have the flex for their children in the holidays. They can just stop one of them. Yeah. So how did you come to find out about PCP?
Well, I know I was always interested in working with people who stammered, and I suppose I got into that because of Peggy Dalton, and Peggy was one of the most imaginative and innovative people who developed PCP in this country, with Faye Francella and some others, and she worked with adults who stammered right from early in her life, as well as with neurological disorders. And she was instrumental in setting up what was then called the Association for People Who Stammer, or the Stammering Association, something like that. It's changed its name now to the British Stammering Association. So I remember going to a one-day workshop with her. It would have probably been early 90s, and being very interested in what she had to say. I think I bought a book written by some of the people who were specialists in working with stammering, and then eventually did an introductory course. And over time, I had the opportunity to go to her for supervision.
Right. Okay.
It's a great influence on me.
Yes.
And I was very lucky then. I was able to leave work one day a month, and just go up to London and sit in her sitting room with a number of other great people, talk for a couple of hours over PCP.
Yes. I guess I must have been at a workshop at the same time as you at some point at Peggy's house, because they ran them there, didn't they?
Yes. And of course, she wrote a lot of books about how PCP, and a very useful approach for people with communication difficulties. And I think that's probably what's driven me all these years. Right at the end of 1990, I had the opportunity then and managed to find some funding to do the diploma course.
Right.
So then qualified as a PCP psychotherapist within PCP. And
sometimes people think that's a strange thing, to be a speech and language therapist who's also a psychotherapist, don't they? No, it's not common.
No. But I think Peggy, it did influence that a lot, because of her dual qualification and the fact that she was always interested in communication difficulties, and in that time, in the sort of the early 2000s, there were quite a lot of speech therapists who were interested in PCP, and I think that's where I and Kathy and some of the others, Claire Morris, we all came from that those origins.
And it seems to me it often makes a lot of sense to speech and language therapists.
Yes.
Because they're thinking about that person and the way they interact with the world. Okay, so how do you use PCP now in your work?
Well, I always did, and I think I used to use it in managing as well, and supervising when I was managing a team. And I suppose it's one of those theories. I was talking the other day to somebody, and it's a theory that fits with the way I see the world, and I think it always has done. And then when you come across the theory, you think, well, why doesn't everybody think like that? Because that's how things are. And then you get really excited, because you then find that somebody's actually written this theory down in a great deal of detail, and a great deal of clarity. And so then you can then start really understanding it and really working through it and really using it. Since I retired, which is about 8 years ago, I gave up the management work, but I had an opportunity to do some work with my adult team locally in the health service.
Right.
Just working with adults who stammer.
Okay.
And so that's what I've been doing now for quite a long time, on a very long-term basis.
And how would you say, for people who don't know anything about stammering, maybe, other than what it is, how does PCP help with them?
I think it's because it's this whole idea of communication and validation of the self and who you are as a person and as a social being. We have an innate urge to communicate, to connect with each other. And I don't think if you have a communication difficulty of any sort, you can remove that, dissect that from the person in which it's embedded. And I think we've moved a long way from just looking at what are the symptoms and trying to change the symptoms and the medical model. We are so much more involved in the whole person and how they make sense of their world and the meaning of those difficulties for them.
Yeah. So what sort of things happen with people who stammer when you're trying to help them with it?
Well, we would get, when I worked with children, all those time ago, we would work very much with the parents, but we would be looking at reducing the child's anxiety. We would look at encouraging them for the child to enjoy their talking and developing their confidence socially, because that's the thing that happens. And so when you get an adult who comes along whose stammer has not recovered from childhood, they are very often feeling that this has made a big impact on their life. So they might have decided the sort of job they can do just because they might not have to talk too much.
Yeah.
Or they've depended on other people to introduce them, make phone calls, go into shops and ask for things, or you might get someone in quite considerable restricted lifestyle who just hardly ever talk to anybody else outside their immediate family. So it can have a really significant impact on how that person sees themselves.
Yes. And it must be very difficult for people who stammer at that very first interaction with someone. When you already know that you're presenting yourself and you don't want to be a stammerer maybe, and you don't want to stammer at that moment, and then your anxiety would go up, I guess.
That's absolutely right. And a lot of people will put a huge amount of effort in avoiding stammering because they don't want anybody to notice, because there is a view that, well, these disabilities shouldn't be like that.
Yeah.
People should be normal and they should be able to talk properly. And therefore there's a discriminatory factor.
Yes. Yeah. So would you say that for some people who stammer, it actually impairs their job prospects?
Oh, yes.
And have you met people who've made choices, to, if you like, to underperform because not talking mattered more than facing that situation or doing that job or whatever?
That's right. So they would choose jobs where they didn't have to use the phone, or they would choose jobs where they didn't have to talk to other people, or they would decide not to go for a promotion or go for an interview because what will people think if I stammer? They'll think I'm no good. So there is a perception that if you stammer, you're thick, you're stupid, you're no good, you can't be good at your job. But of course, over the years, I've been lucky enough to work with people in all sorts of interesting jobs and some very high-flying jobs, and they've just disproved all of that. And one of the nice things is that you do learn lots of things about lots of interesting jobs, because I'm always nosy about what people do and how they spend their time and so on. So it does allow you to be very nosy. And
And what, in terms of stammering, when you're trying to help an adult, would your focus be on the construing of that person in terms of PCP work?
Yes. Yes, you want to know how this communication difficulty fits into their construing.
Right.
What are the core constructs for them about communicating and relationships, and how they see themselves moving on and changing.
Yes.
And not being held back.
Yeah, okay. And do you find it takes quite a long time for people to shift that thinking? It's construing, isn't it? That they're developing new constructs, they're stretching constructs, they're looking in a different direction at their construct system. That takes quite a while, I should think.
It does, and I've been fortunate where I've been working here is that I have been able to see people for quite long periods of time. So it might be a year or more that we're seeing them. So we might start off fairly regularly and then keeping an eye on people. And also it's always about experimentation, because they're going out into their real world, their everyday world, and they're trying things out. So it might be just smiling at somebody that they don't know, or it might be when they've been in a shop saying thank you and goodbye. It's all of that experimentation, letting taking over jobs or tasks that they've never done. So, for example, making phone calls that their partner's always done for them.
Right.
So lots and lots of experimentation there, which enables them to elaborate their role as a fluent person.
Yeah.
It comes back to that very, very early work that Faye Francella did in the 80s about the person who stammers does not have many constructs about being fluent.
Yeah.
And also convincing them that they can be a really good communicator and they can have really good social relationships.
Yeah.
Sometimes they stammer. So there is an acceptance there. And we always say, I'm sorry, we're not going to stop stammering. We're not curing you. We're not.
Yeah.
And that's the first hard message to convey.
I guess for some people that's desperately upsetting.
I think people, when they get to adulthood, know that, but you're a bit blunt about it.
Yeah. So, I mean, I can remember reading Faye Francella and Peggy's stuff about stammering and about speech and language stuff and thinking, of course, it makes absolute sense, doesn't it? That if you don't know how to construe yourself as fluent, how can you be fluent? So, and that goes the opposite way, I think, to a lot of therapy to do with probably speech and language type things. It's going sort of round the back, isn't it, to look at the constructs, and then maybe people can change what they do, rather than just focusing on what they do. Like there's some sort of speech and language therapy where they stand in a town and talk, isn't there?
That's right, yes.
Which, to me, would be terribly anxiety provoking, regardless of not having a stammer.
I think it's terrifying, and that's really based on the fact that you do lots and lots of exercise to stop yourself from stammering, and that does suit somebody, some people. But it's a bit like going to the gym. You have to do your exercise every day,
right? Yeah.
And then what worries me about that is if you don't, and or you are still stammering, then you can feel incredibly guilty about that I haven't worked hard enough.
Yes.
I would be able to speak normally, or so on and so forth. So there has to be a lot of emotional and psychological support in that change, I think.
Yes.
It's such a core. I think we're working at the core.
Yeah, absolutely. It's communication. You can't get anything more core than that, can you? and it's always been there. It's not like you develop communication after a certain age. You're always communicating, aren't you? Your whole life, even before you're born.
Yes, absolutely.
All that stuff's going on. To struggle with it is very debilitating psychologically, I would think. Oh,
it can be. It can be. I think, and we've come across people they've had serial invalidation throughout their lives as no good.
Yeah.
Stupid. You can't. Yes. Therefore, you can't do this, and huge psychological trauma that.
Yeah. Yes, very tough, I think.
Yeah, and I think now the other thing which has been great is that working in an adult team, then I'm working with therapists who are working with neurological disorder as well, and with lawyers. And so that's enabled me to do some training. They've allowed me to do some PCP training with.
Oh, great!
And they're all experienced therapists. So, if, for example, you take a patient who's had a stroke, then their life has turned upside down. They may not be able to communicate verbally at all. They may have difficulty with eating and drinking, something they always enjoy doing. So the whole sense of self is just traumatized, really.
Yeah.
And working with those therapists who are working with those patients, they've valued the PCP approach of looking at that person reconstruing their new life.
Yes.
And the impact that it will have on their relationships.
Yes.
And the how everybody else has to adjust their way of communicating to make sure that they don't then dominate and take over the person who's had the stroke and talk for them. And that funny old thing about does he take sugar? That
yes,
that we used to.
Yeah.
In other words, finding a way for that person to communicate and still be a valid sense of themselves, even though they've got a lot of impairments.
Yeah. And do those therapists do a lot of work with the carers or partners of those people?
Yeah, sometimes they will, yes.
Yeah, because that must be very tricky, I would think. And the PCP approach would help them with that, wouldn't it? Because, they would get an idea of, okay, this is about people just don't know how to construe their mum anymore, say, because now she can't talk in the way she used to. So, how do you help them to develop the constructs, which means, the mumness isn't lost completely.
Exactly. That person is still there, even if they can't say what they want or what they think. There's still a person in there.
Yes. So have you got some go-to techniques in terms of PCP, stuff that you would usually use or often use, or things you think have been particularly useful in your line of work?
Well, I think I've already mentioned the experience cycle, and I think that is a very useful little idea. And also, quite often when I've met with people, they make problems making decisions. So when you look at the CPC cycle as well, about how people make decisions, or how they're preemptive, or how they continue to prevaricate and can't come down on a decision.
Yeah.
But I think some of those basic techniques like pyramiding and laddering is very, very useful. And then if you're talking about relationships within the family, then Harry Proctor's work on relationships and pegs is
yes,
such a simple and easy way of doing it.
Yeah, I think the peg's great. It's easy to do, but gives you loads of information, doesn't it?
Yeah, and it's an easy thing for somebody to look at and talk about.
Yeah, definitely. What kind of things do you notice when, taking a PCP approach in terms of the way that you work is maybe different from the next person who knows nothing about PCP? What's different about your practice, you think, because of the PCP?
I think it's probably looking at the whole person and looking at their sense of themselves and what's the meaning for them, rather than looking at the impairment. So I think if you work in a medical setting and you work with people who've got a medical problem, there is still an influence of medical construing or a medical definition, diagnosis for this person. And I'm always trying to move away from that if possible and say, well, what is this? What do we want to know about this person and their life?
Yeah. So you're maybe getting more at a more holistic person-centered approach than a diagnosis. To me is something that sort of pops onto people. And sometimes it doesn't fit very well, so we squeeze them and try and make them fit in.
Absolutely. And I think this is, especially when you go into psychological distress and mental health, you're looking, the more and more I read about this, the more you realise that what some professionals are doing is looking at this person and doing exactly what you've just said there, trying to fit this person into one particular box or another. Observation or describing how this person's behaving, rather than working out, well, what has been happening to this person? How have they got to where?
Yes. And I always think that that kind of approach means that a lot of time can be spent doing extra assessments, none of which lead to a better outcome. Whereas if you got on and started doing the work, you might actually move a lot quicker. Yeah. So is there some kind of either a training course or any training that you've had? I mean, you've already referenced Peggy as that have been particularly good and helpful to you in your practice as a speech and language therapist in PCP.
Well, it's interesting because I did the 4-year diploma and I learned a lot and I read a lot about the sort of the pure side of PCP, if you like, the original. But I think it's only over those years, those 20 odd years since then, and the more I've worked with it and the more I've been teaching and supervising, the more I'm understanding the depth of it. And we've been very lucky in that we've had some good books have come out in the last few years as well, with some new ideas. So I do try to keep up my reading and looking for new ways of doing things or new. And also with any teaching, you're always getting the participants to work on themselves. And that, again, is something that people have to start to understand and reflect on and move towards being a reflective practitioner rather than following a checklist or a structure or a structure or something.
Yes, and it's quite different, I think, from that point of view. That you can't say, here we are at A, the next step is going to be B. You might be, here we are at A, I got no idea what's going to happen next, because this is a real human and we'll have to see where we go with that. And that can be quite anxiety provoking for people, I think.
Absolutely, yes. And that is the biggest challenge, I think, when people start to work in this way, is thinking, well, I might have this plan for this session with this person, but you've got to be prepared to be completely blown off track and just go with whatever that person brings with you that day, whatever distress or whatever achievement they bring to your session on that day. That's what you're going to work with.
Yes, yeah. And then the therapist's job is to see where the threads are, isn't it? To help people to, Tom Ravenette used to say, illuminate, and I think that's great.
Yes,
because those connections are there, and what you're helping them to do is see them rather than create them. They're not creating them for you. You're just helping them to notice. And I think that's kind of what we have to try and do with it. Where I think what's interesting is, you're a speech and language therapist, I'm a psychologist. It doesn't really make any difference.
No.
In terms of what we're trying to do. We're trying to alleviate distress. We're trying to help people who are stuck. And we're all in the same game, if you like. And that's the other thing that I really think is beneficial about PCP. It doesn't say this only belongs to one profession.
That's right. And it applies to every single one of us.
Yeah. It applies as much to me and you as it does to the people that we work with. To me, that's very refreshing. So in terms of what you're trying to do in PCP, you're running some courses. Can you tell people a bit about that?
Yes. Straight after I qualified, I got drawn in by various people into helping out with some of the assessments and so on that people were presenting. And then we tried to revise and redevelop a diploma course back in 2016. And it was a tricky time. It was very difficult for people to find any funding. And so things are sort of laid a bit fallow since that time. But you in Coventry have been ploughing on with your foundation course. And I've been doing mine in my own little sort of localities. I've got a small group of independent speech and language therapists that I've taught at a foundation level. And likewise with the colleagues that I work with in adult services, I've taught at a foundation level. And I'm always sort of asking my bosses if I can have a few more days. I'm hoping I can this year, a few more days of teaching. And there's only half a dozen of them, but it's enough of a group to keep it going and for them to pass the word down the line. Always thinking in terms of succession planning. What is it when I eventually do retire? Who's going to do this work? I don't want this service into it. So making sure there are some people who've got enough understanding and enough passion about that work to want to carry it on. And then I've worked a lot with Kathy Sparks, and we've now launching another foundation course online. We're just starting that.
Ah, great. Okay. So maybe I'd be able to put a link in. If you could send, is it best for people to send you an email? I can put your email in, or I can put a specific link in.
Yes.
So, and particularly, I think, the nice thing is that we've got PCP going on. There's some going on in Edinburgh, there's some in Coventry, and there's some in and around London and the south. So, we're spreading across the country quite nicely. We need somebody in Bristol, don't we, or somewhere like that now. I suppose because it's online, they can be anywhere anyway.
They can. Yes, they can. Yes. And it's interesting that I think there's going to be, it looks as if there's going to be a move in terms of the sort of professional status and the registration issues just because of the lockdown. And And even the UKCP, which is the registration body for psychotherapists, are looking at, first of all, diversity, because an awful lot of counsellors and psychotherapists now are sort of middle class, middle age, white, female. They're very, very poor in that sense. And are actually facing the fact that it's too expensive.
Yeah.
If you do a training course, whatever modality or theory you're in, you're talking about, I don't know, £6,000 a year for 5 years plus extras. Now, that's crazy money.
Yeah.
So they are now beginning to understand that there is another way of doing it, or there may be. And we've, the chairman of the PCP Association has been very actively just negotiating and getting into people and talking to people and saying, hang on, why can't we do this in a more acceptable way, in a more approachable way, so that people who've got years and years of experience of working psychologically and some understanding and knowledge of PCP can come in and get a qualification of some sort. And so that's something that we're working on at the moment. So that brings in other people from other fields, we hope, over time.
Yeah, that's good. So that's through the PCPA?
That's right, through PCP Association, yes.
Yeah, I'll put a link to the PCPA in the notes as well. Yeah.
Yes.
Yeah, okay. So if people are interested in a course, they can contact you. Mm-hmm. Is your supervision group open? And I know Kathy does supervision as well. You know, if you're full up, you know, do you pass it on to Kathy and say there's a speech and language therapist particularly looking?
Yes.
Can you?
Yeah, I mean, we'll have a lot of contact with each other, and she's run supervision training for a long time.
Yeah.
And at a really good level, so that people, not necessarily delivered as a PCP training, but very much influenced by it across the therapies. And she runs groups. I do some one-to-one supervision as well with people in various fields.
Okay. And do you do that on Zoom or similar online?
Well, some of it used to be face-to-face, but of course now it isn't. So.
Yeah. But I think that improves accessibility, doesn't it? That someone can be in Blackpool and still meet with you. Because there aren't that many people who are speech and language therapists who are able to offer supervision in PCP.
That's right.
So it's good that that's accessible. So if people want to contact you, would you rather they did that through PCPA or
no? They can
email in.
They can email me.
Okay. All right. That's great. Good. Is there anything else you think that people who are maybe newer to PCP would be helped by?
I think it's that continuing developmental pathway. So I think the foundation course is good. We did an introductory day to begin with this year, back in January, and that captured about 8 or 9 people, which was so that it was just a really, really quick overview. And then those decided to take that further. I think the books that you've done and that Adele has done are very useful, and they're very accessible, they're very readable, and they go alongside a foundation course. So I think is quite useful there is you get a lot of experience and theory, basic theory in your foundation, and then you can go back to the book and you can read it up again, or you can read it a different way, just to improve that understanding, because there's nothing like going over something in several different ways to ensure that you're understanding it and you know what you're talking about.
Yeah. Okay.
And then I think maybe that is the workshops that are run in Coventry, and I think probably that's the other field that over time would be nice to develop particular topics.
Yes.
You can engage with those.
Yeah. And it's been a good year for PCP, hasn't it? Because the stuff's been online and people have come from all over the world, which is very different. Normally we're in our own country doing our own country's things. Right. Or, we did have someone came from Iceland, but, that's a rare thing to have someone come from abroad to something in the UK. So that it's been lovely to see who those people are in other countries using PCP. So, I think it offers us potential now. And now we've all got used to doing it.
and maybe those international conferences have died a death.
Yeah.
the expense and everybody's guilt about flying across the world. And do you have to?
Yes.
There is we all miss it, because I mean, we started off talking today about communication and relationships, and it is different when you're not in the same room, not close to each other, and that the quality of that communication is different.
Yes.
And I think that's the other thing that we found working with our clients online, is that you still only get that little bit of head and shoulders.
Yeah.
And we want to see the whole body. What is this whole body telling us about this person?
Yes.
Yeah. The way they see themselves. What's this whole organism like?
Yeah.
How is it functioning? And that you can pick up so many little hints when you're in the same room as someone.
Yeah.
We're missing that now.
Yeah. I think most people who work with people would much rather be face to face. But if it's an alternative between none and Zoom will do, won't it?
It will, and we've kept it going. We've been working right from the very, very beginning. We've been working with all our clients. We haven't interrupted our service at all.
It's good. Yeah, great. Well done.
Yeah.
Okay, thank you. That's really helpful. Like, what's great is to hear from a different profession, and what I'll be trying to do in the podcast is get people from different professions to talk about their take on PCP and how it makes sense, because it seems to me one of the few things that can go across all professions. It doesn't matter if you're a teacher in a class with children or you're running a business, you can still use a PCP approach. So I want to try and make sure we represent that. So talking to you has been really helpful, because it's going to teach people who don't know about what a speech and language therapist does about that, but also about how, some of the things they're doing in their work are probably similar. And, we're all taking that same approach where we can.
Yes, definitely. Absolutely. We're really enjoying it.
Yes. Well, that's the other thing is PCP tends to, it seems to make the people who are practicing it quite cheerful.
Well, it's we've always described it as an optimistic theory, haven't we?
Yeah.
There is another way. And even when we see people with the most devastating history, we're always looking for that little chink, that little illumination, as you say, one little thing that's a positive.
Yes.
To move on to.
Yeah. Okay, Adele, thank you so much. That's been great. Okay, so that was interesting. So I think the great thing about being able to do this podcast is to show the different professions and how they can all use PCP. And the good thing about PCP training is you do one set of training and then you can apply it in your work therapeutically or with individuals or with organisations. And that's a very good value training. Next month's podcast is going to be a paper, and I've got some ideas about which one I'm going to talk about. And then we've got a couple of interviews coming up. I try to do now, if I can, probably an interview, and then the next one is a paper, and then the next one is an interview, or maybe not a paper, maybe it's an issue. Okay, I'll see you next month. Thank you very much.